Hello, my friends. As promised, I'm recording this core session so that you can replay it. Do it when perhaps you're not feeling up to your usual strength routine or in addition to your strength routine because it's a great complement. Okay, what you're going to need to do this is a mat. You're going to need at least one cushion and a small rolled towel or possibly two cushions, but the one cushion should be fairly soft, okay? The other one may be a little firmer. You need a resistance band that's fairly light. And then I don't have one, a foam roller, so you can use a rolled up mat, okay? But a foam roller is best. So we're gonna start with some spinal mobility. This is really important to help us with breathing posture. So we're going to get on our hands and knees. We're gonna do a cat-cow. And for the cat pose, you're coming up, right? Through your spine like this, creating the nice global rounding, chin tucked, and you're in a posterior tilt of your pelvis. And then in the cow position, you're doing the opposite. So tailbone to the sky, chin up, you're dropping through your rib cage and navel and trying to create this reverse arch. Now it's important to set up with your hands underneath your shoulders and your knees underneath your hips, okay? And you want to think about keeping the neck long, so don't turtle shell into your shoulders as you come up into the cat position. So you do want to extend your body so that you're pushing yourself up and away, but not allowing yourself to shrink in like a turtle in its shell. Okay, now I'm going to show you the breathing that goes with this, or that I'd like you to try. You're going to inhale on the rise because I want you to send that breath into the back body, and exhale as you come down, sinking through the shoulder blades, exaggerating this arch, keeping the elbows straight throughout, okay? Inhale and exhale. Now here's the tricky thing. For those of you who are squeezing your glutes, I don't want you to do that. I want you to relax the glutes and draw up using your abdominals. Woo! No glute clenching at all here in this position, ladies. And exhale. That's right. You're drawing in from the anterior muscles of the abdomen, not driving this through the glutes at all. Not one bit. My glutes are pretty relaxed even in this position. No active clenching there. And exhale. Let's do two more. Spread the sits bones when you're in this position. Spread them open and inhale. Inhale. Rise up. Don't squeeze your glutes. Please contract your abdomen instead. And now exhale. Inhale. Expand that rib cage and the back body and exhale. Notice how I like you breathing into your back as you arch, because it'll help you think about sending breath to the back body. Now you're going to set up in a sideline position. You'll need just one cushion, the firmer of the two, so your head is well supported. And grab your foam roller and place it underneath your upper knee. So the top leg is bent 90 at the hip, 90 at the knee. And now I want you to take your bottom hand and place it on that top knee. That's because you want to make sure your knee stays put as you rotate. Nothing rotates from the waist down. Everything is from the waist up. Straight arm. And what we're doing is long through the crown of our head. In every position, we're making sure we're nice and long. Create a long neck, okay, through the crown of your head. Now we're going to inhale. We're going to sweep our hand around in a semicircle straight at the elbow and inhale into this open position, palm facing up, and exhale. I want you to take a full breath in the open position here. So inhale through the nose. Exhale completely through the mouth. Inhale and return. Sweeping that hand around, and as you go back and exhale, you can go back. When you're in the open position, look to the hand, keeping the knee down in the front, and inhale. Try not to clench your body anywhere, not your glutes, not anything, and exhale. Inhale and return, sweeping that straight arm around. And exhale to come back. Around you go to the open position. When you're here, I want you to relax and then inhale again. And exhale. Inhale, return. And exhale, go back. And one full breath when you're here. And exhale. Be mindful of the tension. Don't hold tension elsewhere in your body. Relax. Exhale. Sorry, inhale. Now we're going to go to the other side, and we're setting up exactly as we were, only in the opposite way, supporting our head, hip 90 degrees, and our hips are stacked. So I didn't mention that. Obviously, we want to be aligned here, shoulders, hips. We also want to be mindful of that top hip being stacked on top of the lower hip, not rocked forward or rocked back. So knee on the bolster or the foam roller here. And we're reaching now with the other arm. We're going to inhale, sweep around, open up. And inhale again. Exhale. Inhale to come back. And exhale. Inhale. And exhale. Inhale, come back. And exhale. The only reason you'd be tensing is because you're forcing the range. Don't force it. Inhale. Look to that palm. Inhale. And exhale. We're going to take one big breath here and finish off. Exhale. Feel yourself sink to the ground and inhale. So there we've done some spinal work in cat-cow. We've done some rotations. This sets us up well. And for more effective breathing, our rib cage will feel more loose and able to expand. So we're going to get into lying down, supine on the ground, knees bent, feet flat. And I recommend you use a soft pillow for your head because most of us have a slight degree of forward head posture. And what you don't want is to have your chin at the highest point. So a neutral neck and facial position has you with a face that's parallel to the horizon and the floor, the ceiling. And for many, that's uncomfortable with your head flat on the ground. A slight pillow might help bring you into that position. Okay, so with that in mind, the other thing that might help with positioning is a slight cushion to lift the hips slightly. This might be more comfortable for those of you who are in an anterior tilt. So you have a big arch here even when you're in this position. That can be quite uncomfortable and make a lot of these exercises more challenging. So what you're going to do is simply prop your glutes on to a soft pillow, okay? Or a towel, a rolled towel, very slight elevation, not really high up, okay? And that will just do enough to kind of put you into a bit of a posterior tilt, drop your back to the ground where we want it. We want that contact zone. Okay, so now we should feel relaxed. We don't want to hold tension on our glutes or our hip flexors in this position. And to help encourage relaxation, sometimes you can just jiggle, or you can actually contract the glute and then relax. You can find relaxation that way. And we want our neck to be relaxed. We want to be long through the crown of our head, tall. In this case, kind of think long neck, shoulders away from those ears. And we're going to do some breathing first. I want you to place your hands on your rib cage, breathe in through the nose, expand the rib cage out to the side. And exhale completely through pursed lips all the way. Inhale, inhale. With each inhale, the ribcage should move under your hands, and then exhale, the ribcage comes in. Exhale completely. Feel the ribcage draw in. Feel everything draw in as you exhale completely, and say ha at the end. Inhale. Try not to inhale by raising your shoulders. Your neck should stay relaxed, and exhale. The next thing I want to draw your attention to is what your pelvic floor is doing when you breathe. Try and keep those glutes relaxed. Remember, now when you inhale, do you feel your pelvic floor gently lower between your legs? Now you want to maybe put some awareness there. You want to feel with your own hand. See if you can feel that pelvic floor descend as you inhale. So again, inhale. There should be a fullness that you sense there, and then exhale. The ribs come down. The pelvic floor should rise. Think of the pelvic floor as being an elevator in a building. It's at ground floor when you're relaxed. Inhale, drops into the basement, then it comes up as you exhale, maybe all the way up to the second floor. If you can, lift and lift and lift at the end of exhalation. So when you're breathing in through the nose, shift your focus from rib cage at first, expanding out to the side, please. And then exhale, rib cage comes in, everything draws in. Then also the next breath, think about your pelvic floor, keeping relaxed through the legs. Inhale, drop the pelvic floor. Exhale, raise the pelvic floor, not necessarily consciously. It should rise with your exhalation naturally, but then you can exaggerate the exhale and contract into that end exhalation with a ha, and contract the pelvic floor. It's a Kegel, and then relax everything. But if you find you're clenching your glutes, you probably hold some tension back there. You need to work on relaxation, no active contraction. Just try and exhale and feel the front pelvic floor rise with that exhalation. Try and keep the back side relaxed. Inhale. So this is important work, okay? Because your core involves your diaphragm and pelvic floor, and if they can't move properly in respiration, they can't necessarily then brace effectively. So now we're going to practice bracing. We're going to practice an exhalation bracing strategy, which I've kind of alluded to already. It's that end exhalation brace, okay, that normally should happen before you load your spine or your torso with anything. So just as a test, place your hand on your belly and then lift your head. What happened there? Lift. What may have happened is a popping out of your belly and a pushing down through the pelvic floor. And that's a bearing down strategy. What you want is to actually feel the opposite. Everything should draw in the way it did at the end of exhalation, and that allows you to brace properly before lifting your head. So we're actually going to do some head lifts. This is going to help with that forward head posture by bringing some strength to those cervical neck flexors in the front. But the key here is to make sure your chin isn't the highest point. So you want to lower that chin just a smidge, not so much that you're creating a double chin, but just to bring your chin down a little bit, feeling a little bit of engagement even as you do that through your front line. And what you're going to work on is lifting your head like so off, just like you're unweighting a scale. The pillow is a scale, and you're trying to lift the entire face in a plane towards the ceiling. Now, it's important to brace each time you lift first. So what we're going to do is practice an inhalation all the way around, circumferential inhalation, rib cage expands, pelvic floor descends. We even feel back body expansion. With the back of our hands, we can feel whether that inhalation causes our back to expand as well. Then we exhale through pursed lips. Everything draws in. We can finish the exhalation with ha. It sounds funny, but making that ha noise means that we're emptying everything from our abdomen. This should feel tight and drawn down, not up. And then our pelvic floor is up, and then we're lifting the load of our head off of the pillow and hold. 5, 4, 3, 2, 1. Inhale, relax. Pelvic floor descends, back body expands, and we exhale. Lift. 5, 4, 3, 2, 1. Relax. Inhale. Are you clenching your glutes? Check in with yourself. Relax those glutes. You can contract them and then relax them to bring relaxation. Inhale. Exhale everything you've got out. Pelvic floor comes up in the front. Don't clench your glutes. And then lift your head. The plane of the face is lifted off of the back. You shouldn't feel the superficial neck muscles so much as a deep choking, almost like a choking sensation from the right muscles being contracted in the front of your neck. And then relax. Inhale. And exhale. Lift. Hold. 5, 4, 3, 2, 1. One more time. And exhale. Lift. 5, 4, 3, 2, 1. Relax. If you don't feel what I'm saying, that slight sort of, it's a choking sensation because there's a tension that grips your front throat when you're doing this correctly. If you don't feel that, tip your chin down just a smidge, not ton, just enough that you kind of feel that sensation, okay? And you should feel your abdominal muscles contract there too. This is a really important exercise. It seems like nothing. 5 times 5-second holds is gold. Okay, now we're gonna move to learning how to achieve pelvic tilting with our low abs. We're gonna learn how to zip up our low abs. We're gonna learn how to draw up our low abs. We're gonna do this pelvic movement, this belt buckle to the rib cage without involving our glutes at all. I think all too often people are inclined to achieve a posterior tilt like we do in the bridge by squeezing your bum to get your pelvis in position. I don't want you to do that. I want you to think about drawing your low abs up, okay? They're what control that front pelvis, that pubic bone drawing up. So what we're gonna do is breathe in and then exhale completely. Then gather your low abs and without contracting your glutes, lift and hold. 5, 4, consciously relax the glutes and your bum and then relax everything. This can be really challenging for some people at first, but with practice it improves. Exhale. Lift. It's like doing a little tuck. You want to really feel tension in the low abs here. And hold. 5, 4, 3, 2, 1. And again. It's a very subtle movement. You won't be able to see me doing it, but I'm not squeezing my glutes to make this exaggerated. I'm simply lifting and holding. If you've got that down, this is like groundwork for what comes next. What comes next is a marching exercise that encourages cross-body or rotational control of the core. I want you to place your thumb on your lower rib cage and your long finger on your hip bone here, your pelvic bone in the front, your ASIS. The relationship between these two are allowed to open and close, okay? But they're not allowed to shift rotationally, right and left, okay? So they can't do this. So when you inhale, these will spread apart, and as you exhale, they'll come together. But their vertical relationship, lengthwise, won't change. Then what you're going to do is when you're fully exhaled, hold there, and then lift and lower the feet in an alternating fashion. Just a little bit off the ground. We're doing 5 reps. 1, 2, 3, 4, 5. Relax, inhale. This is all building on itself. The inhale is always, as I tell you, pelvic floor, back body, everything. Exhale, everything comes in, including the pelvic floor draws up. Exhale completely. Once you're braced, then you're lifting the leg, alternating 1, 2, 3, 4, 5. Very small movements, but absolutely no rotational shift. And that's really challenging to do. You have to learn how to lock everything down, not only this way, but rotationally, okay? So inhale and exhale. Ready? 5. 1, 2, 3, 4, 5. Inhale, rest. Be honest with yourself. Are you feeling any rocking side to side? Exhale. Once you're braced, 1, 2, 3, 4, 5. Inhale. Exhale. Lift. 1, 2, 3, 4, 5. Inhale. So you can work on sets of 5 repetitions, okay? And you can extend to 10 repetitions. That's progressive overload. So the length of the set will lengthen as you add more reps, okay? No rotation. Now, if that felt easy for you, the next level up is a legs only dead bug. We're gonna do it with the same attention to breathing and the same attention to no rocking, but also in this case, it's really important that your back stays against the mat and there's absolutely no movement. So for a lot of people, when they're doing this, I need their hands in 2 places. First set in the front like we just did. Second set, I want you to put the fingers in your low back. This is to sense whether or not you're lifting at all away, okay, from your hands. So for the first set, you're going to inhale and then exhale. Establish the bracing. Lift your legs. Everything should have stayed low and tight. Now you're going to alternate leg lowering. 1, 2, 3, 4, 5. Inhale, lower, reset. Exhale, now hands here. Once you're braced, lift the legs and no rotation, but also no movement of the back as you alternate the legs. Okay, and down. So inhale, exhale. Everything's down. We lift. We have contraction here. We're going to go 1, 2, 3, 4, 5. No movement of the back. 6, 7. It depends how many you can do. Try and extend the set based on how long you can hold the back. So you don't want to feel any movement. Now, as much as I'd like to lead you through multiple sets and meet everyone where they're at, it's impossible, because now some people will have found that easy. If you can do 10 marches with your feet like floating, the next set level up is to lower your heel all the way to the ground keeping the knee bent. I'm not extending my leg here, okay? Being able to do 10 alternating reps like this without rocking and without letting your back move is the next level up. Beyond that, then you can move to the next level, okay, which is extending the leg as you lower, always thinking of the same cues, okay, moving nice and slowly. It might make more sense to do even numbers. I said 5, you could probably do 6, so there's 3 per leg, and you could work up to 10, right? 5 per leg, 10 reps at each level before moving up. So it would be 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So work your way up. Start with 5 or 6, work your way up to 10. There's no magic here. And choose the level with respect to what your legs are doing as far as what's challenging for you. But be true to the position of your pelvis at all times. Okay, we've gone through enough instruction with that. I want to show you another exercise that I really like. It gets you into a half kneel, which is wonderful core work because it encourages stability in the pelvis in this plane, okay? So now we're involving, in the lying down position, we don't have to worry about our pelvis as much, but now we have another dimension of load and control. In half kneel, what you're going to do is you're going to make sure that your hip is at 90, knee is at 90, and I want you to level the pelvis. So a lot of times this hip will sit high. You're gonna place your hand on that hip, that glute, and just sit into that hip. That way your pelvis is level, and you're gonna grab your band, hold it at arm's length, shoulder width apart grip, okay, so shoulder width grip. And I want you to be aware of a few other things. And you're gonna practice good foot mechanics. You're going to splay the toes. You might have to manually spread those toes out. Don't clench your toes, but activate your arch, okay? Nice active foot, but with a nice spread toe and no clenching of the toes. Now, you're tall through the crown of your head. That's the last cue I'm gonna give you, okay? So we talked pelvis, we talked foot. Of course, there's knee over mid toe. We want everything to be nice, and we wanna be tall through the crown of our head. So from the side, I'm not here, I'm growing as long, as tall as I can. Now, I'm going to inhale here. And as I exhale, I'm gonna pull my shoulder blades together in the back. I'm driving this movement here, and I'm holding 5, 4, 3, 2, 1. Inhale. Allow everything to descend, pelvic floor descend. Now I'm gonna contract. Rib cage should come down. Everything flattens in the front. Pelvic floor raises up. I'm squeezing the shoulder blades, and I'm holding for 5, 4, 3, 2, 1. Inhale. And exhale. Squeeze the shoulder blades. 5, 4, 3, 2, 1. And exhale, or inhale, excuse me. And exhale. Everything flattens in front. Remember, we're gathering everything. And hold. 3, 2, 1. Exhale, inhale, excuse me. And exhale. Stay tall and hold and inhale. Okay, so we're going to alternate that with a reverse plank. Now, those of you who have stiff wrists are going to find this a little challenging. I recommend that you get on a 2x4 or 2 yoga blocks so that your fingers can bend over the edge. Otherwise, you're going to place your hands like so, and your feet are flat. And at first, you can keep your knees nice and bent. I want you to open your chest. Okay, so too many of us are always here. You're going to use this opportunity to expand in front here. proud chest, tall neck, okay? And we're going to inhale into that front body. In this case, I do want you to think about chest open, enter the breath here. And as you exhale and contract everything, rib cage comes down, and you're just gonna push your hips up a little bit. Not much, okay? Just a little bit off the ground. I want you to think about holding in this position, open chest, shoulder blades are pushing you actively up, okay? So you're thinking pushing the shoulder blades, and hold. 5, 4, 3, 2, 1. Sit down. Take a breath. Open the chest as you inhale. And exhale and push up. And hold. 5, 4, 3, 2, 1. Inhale. Keep that chest open. Try not to sink in here. Open chest and exhale. You can make it more challenging by walking your feet out, hold. You can even straighten your legs, but I wouldn't keep your knees like locked out. Keep them bent, and it's not about the glutes. Keep the glutes out of this, please. Push your shoulder blades down, 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 and a little bit together, proud chest, and then rest down, okay? Inhale into that open chest position, shoulders back, and now lift. This is really good to help get those shoulder blades moving down, okay? I like this. So you can do 5 reps of 5-second holds, and then I want you to come back to this. Come back with me to, now we're gonna set up with the opposite leg in this half kneel. Remember to sit into that glute, okay? Okay, so you want level hips, you want a nice active foot, but not a gripping toe position. Shoulders down away from your neck and ears, and you want a long neck. You want to be tall through the crown of your head. You want to grip that band. You want to think open chest, and now squeeze the shoulder blades as you exhale. And 5, 4, 3, 2, and 1, and inhale. Is your pelvic floor moving? And exhale. Rib cage down, pelvic floor up. Squeeze the shoulder blades. 5, 4, 3, 2, 1. Inhale and exhale. 5, 4, 3, 2, 1. Inhale and exhale. 5, 4, 3, 2, 1. Inhale and exhale. Squeeze. 5, 4, 3, 2, 1. One more. Inhale and exhale. 5, 4, 3, 2, 1. Excellent. We want those rib cage muscles working when we breathe, those intercostals, but we also need the muscles of our shoulder blades working well for good posture and breathing. We're going back to the reverse plank. We're setting up here. What we're going to do is open that chest and breathe in. And as we exhale, we're just going to lift. Breaths as you exhale. Press up. Press up. Choose your level, okay? You can even lift a leg here as a suggestion, okay? Pelvic stabilizers, upper hamstring, and release. Inhale and exhale, come up. Other leg if you're doing single leg. Press up. Don't let yourself sink through those shoulder blades. Push yourself up as high as you can. And now sink in, okay? Relax. Inhale. And as you exhale, push those shoulder blades as far down as you can. Make your neck really long. And again, you're doing your own option here. Your leg can float. You can do single leg. You can have your legs bent. Relax, come in. Forgive my phone ringing. And inhale. And exhale. The main thing I want you to think about is sending your shoulders down, okay? And then relax. So we've done 2 sets. You can do 2 more if you like, but this is great for a shorter, quick day. Now, the last thing I'm going to show you, I want us to work a little bit on the muscles of the side pelvis. So stabilizers here include the glute medius. Now, a side plank is often done incorrectly. We're going to make sure we set up properly. We want to be aligned, again, ear, shoulder, hip, and knee. If the knee is forward, you're not activating the right muscle. You want to have that knee back, okay? The upper leg can be extended and slightly out in front for stability. Now I want you to think about how well supported you are through that elbow. If you're sinking, I want you to push yourself up. And then I also want you to remember to be long through the crown of your head here, okay? Lots of things to think about in this setup. And then what you're gonna do is inhale, exhale, bring your rib cage down. And as you do that, I want you to lift and I want you to hold. And you're gonna hold 20 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Relax. We're going to move right to the other side, set up exactly the same way, supporting ourselves on our elbow here and our knee, our lower knee. Our upper leg is extended out in front slightly, but we're aligned, okay? And we're supported through that shoulder. That's so important. Shoulder blade stability. Ready? And we're going to lift and hold. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. I didn't cue the breathing for that one. I like you to exhale and lift, okay? You don't have to hold your breath for the whole time, but it just helps with a bracing strategy to do the contraction or the lift when you're braced. So the other thing I want to show you is obviously there's different ways to do a side plank, and we'll do more difficult variations in the next set. But the other muscle group that I want you to be working, and in fact, it's probably best not to work it. It's very awkward to do an adductor plank. So what I want you to do is do adductor slides, okay? If you're on a floor and you can slide, you can actually wear socks to make it easier, or you can put tea towels under your feet. But what you're going to do is stand together at first, okay? I want you to think about sliding and then bringing your legs together. Out and in. Out and in. Out and in. I'm not in an ideal position to demonstrate this because I don't have my socks on. If you're on a carpet, you can use paper plates, and this works really nicely. But for today, what I'm going to show you is drawing your legs together using the inner thigh muscles. So you need to be able to slide, okay? Out, in, out, drag your feet together. Step out, drag your feet together. So you're never really over on one leg or the other. You're sort of centered, and here you are. And you're dragging your feet, your legs together using your inner thighs. And I find this a little bit more beginner friendly than those side planks that have you hanging off of your inner thigh. So I would recommend working that muscle with your side plank. So going back to the side plank. What we're doing in more challenging variations is working off of the ankle or foot. So we're going to line our bodies up again. Remember that. We don't want to be crooked. We want to be straight. We want to be supported through our elbow or our shoulder. And we're going to raise ourselves up. And it's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. This is working obliques, but what you don't want to do is, I sort of alluded to this, it's hard to talk and count. Don't thrust your chest up too much with this, okay? That's a common form fault. Other side, I'm going to show you the even more advanced variation, okay? So come up and lift the leg. So that's sort of more challenging, and don't overdo it. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Now, I'm going to say something, it's hard to count and talk, right? But you need to realize where you want to feel this. And if you're feeling this right in that front pocket muscle area, then you might want to tip your upper hip back just a smidge. So if what you want to feel it is in your back pocket muscle. So if I had my hand in my back pocket, that's where I want to feel it. And a lot of times people will feel it too much in the front in their TFL. And so really then I just say just a smidge, like rock yourself just towards the back. Pelvis is kind of opening towards the ceiling just a bit. And that usually does a lot to shift where you're feeling it, okay? Now we're going to come back to those adductor slides. And again, you know, like it's a pretty simple exercise. You don't have to think a lot about breathing and bracing for this necessarily, but it's a great one for those inner thigh muscles. So you can step out and then draw your feet together. Step out, draw your feet together. Step out, draw your feet together. And I would do 5, but I'm going to end up leaving the screen, so I'm not going to do that for demonstration. But I would say do 5 in each direction. You can work up to doing 10 in each direction. It'll be a longer working set for the, and go in each direction one time in each direction. You want to make it equal, obviously, and build on it. So the first time you do this exercise, you might want to go back and forth just once. Maybe you do 5 in each direction the first time. And maybe you add more reps in that direction. So 10 in a row that way, 10 in a row that way. Maybe you add to that by going 10 in a row and twice back and forth. And so you can really, and same with the side plank, you're gonna add the challenge first by extending the time from 20 seconds to say 30 seconds. Beyond that 30 seconds, maybe add difficulty by moving to your feet from your knees, from the feet together to the top foot floating. So you want to sort of choose your challenge. And in any case, I hope that was helpful. I really think this is really a great routine to kind of make us feel really locked in and also relaxed. So we need a bit of both. A good system is not just able to brace, but it's able to breathe and relax. So I hope you found that useful. Give it a try and let me know if you have any questions.